What is the difference between polycystic ovaries, PCO, and polycystic ovarian syndrome, PCOS? These can be quite confusing, trying to understand the difference between the two, especially if you've been diagnosed with one of these and you're just not sure what that means for your body, what that means for your health, and especially your fertility if you're on a fertility journey. The main big difference is that PCOS is a metabolic condition, whereas PCO is really just talking about the structure and the kind of energetics, I suppose, of the ovaries. Let me backtrack. Each month in a menstruating woman's body, you will have 1 or 2 follicles on each ovary start to develop. Follicles kind of like a big hair, and it grows out of what looks like a cyst. Very, very different to when someone says they've got cysts growing on their ovaries and they are pathological and they need to be removed. The cysts that grow during normal healthy ovulation are perfectly fine. They're meant to be there. So that first bit can be confusing to start with. When that follicle has grown to a certain length, it releases an egg. And that's what happens during ovulation. And if you were on a fertility journey, that would be your perfect window to start baby making. When we've got poly, meaning many of those cysts on an ovary, and when you've got PCO or PCOS, it's kind of classified as when you've got maybe 20 to 30, maybe more, on each ovary or on one ovary. Essentially what's happening is that all of those cysts are trying to produce a follicle each, and they're all in competition with each other, instead of it just being 1 or 2. So what that means is that the follicles actually cannot get to a proper length in order to release an egg, because they're all competing for the same space. And so what this usually shows up as for someone who's got PCO or PCOS is that they might have really, really, really long menstrual cycles, where it might be 50 days, 80 days, 100 days before they actually have a period. Because in those times where the body has been trying to ovulate, there's just been way too much competition in there. For polycystic ovaries, this doesn't necessarily mean that there's an issue with the metabolics of the body. It's simply that in Chinese medicine terms, there's usually just not enough qi and blood and energy getting to the ovaries in the first place. This is something that's very, very common when women have been on the oral contraceptive pill for a long time, and then they decide to come off the pill, and then they wonder, why am I not getting my period straight away? I'm not even sure if I'm ovulating, because the ovaries have kind of been put in stasis for the length of time that you've been on the pill. In those kinds of situations, Chinese medicine is phenomenal at trying to help the body get back into rhythm and get the machinery working again, help the ovaries to remember how to do their job. It can take a little while, but we see fantastic results. When you've got polycystic ovarian syndrome, it's just a little bit more complicated, because the testosterone in the body and the body's insulin resistance usually plays a big part in why there's polycystic ovaries in the first place. So for both of these instances, if you were going to see a GP, they'd probably be looking at slightly different markers on blood tests. They'll probably want you to go and get an internal ultrasound so they can get a snapshot to see how many follicles are trying to grow on one or both ovaries. But then they're also going to want to have a check and see, what are your androgen levels like? What are your testosterone levels like? What's your blood sugar like? And those last 3 things are going to be more relevant for polycystic ovarian syndrome. For both of these situations, nourishing the body is really important. So making sure that you are actually getting enough good quality food into the body, and just checking in to see what your sugar cravings and your carbohydrate cravings have been. Sometimes we see that with PCO, that people are just living on caffeine, living on sugar. Maybe they've been running their own business, or maybe they've just had their foot on the pedal for a long time. Or maybe it's just the body trying to regulate as they come off the pill and start to get their cycle running well again. For PCOS, it's often helpful as well to start thinking about introducing movement into the body that has a little bit more of a weight training or a weight resistance component to it. I'm not necessarily talking about smashing yourself doing cardio, but when you're doing something like repeated sets of squats or movements that help to work the big muscles of the body, that can be quite fantastic to help regulate some of your blood sugars and to also help to manage the high levels of testosterone that could be floating around in the body. Having a nice amount of protein in the diet is always a great idea. My preference is for meat, but of course there are ways to get around this if you are on a plant-based diet, to make sure that you are hydrated well, to make sure that you are just monitoring your stresses, and also to build yourself a great team of people to support you, because both of these situations can be stressful, especially if you are trying to make a baby and you're wondering, I don't even know if I'm going to be able to ovulate to get this party started. So I just want to reach through the camera right now and give you a nice big hug and say there are lots of people out there that can support you, lots of really well-trained, amazing practitioners, especially acupuncturists and Chinese herbal medicine practitioners that are going to help you find a sense of getting back to your body again, helping to regulate your system, helping you to feel like you are connected again with the feeling of being whole and complete. And take a little look, see who's in your area. Make a connection, make an appointment, and go and get some extra support for what you're going through.